Hi, I'm Dr. Megan Landis, a board-certified dermatologist, answering your questions that were sent in, some of them as many as we can get to. Thank you for sending in such wonderful questions. We'll get to as many as we can over the coming weeks to months. My original trusty sidekick, my sister Michelle, is unfortunately unavailable, so I have my husband, Dan Block, who has kindly jumped in to help.
All right, so let's start off with the first question. What kind of sunscreen do you recommend?
Any kind that you will use consistently and appropriately. You definitely want to make sure it's at least SPF 30. Most sunscreens out there are pretty good. You do want to make sure that you're applying a thick enough layer. So a shot glass amount is enough for the size of one average adult. And the reapplication is what often gets people. So again, make sure you're putting plenty on, a plenty thick layer, and that you're reapplying at least every 2 hours. Sun protective clothing, a good wide brim hat, long sleeve shirt is also super helpful. This is something we use for our kids. As far as sunscreens go, we have a broad array of them. This is a great daily moisturizer with sunscreen. So the zinc or titanium containing sunscreens, the mineral sunscreens or physical blockers, those tend to be better for sensitive skin, and they're effective immediately, versus if it has a chemical blocker in it, such as this one. Also great sunscreen, but you do need to put it on 30 minutes before going outdoors. So again, we use all of these. The sticks are great for the kids. We have this large pump that is fantastic, very cost effective, super convenient. And again, it's a zinc titanium containing sunscreen. The sprays, I know there's a lot of people who are huge fans of the sprays, and they're not bad per se. However, just think of when you spray paint a room, for example, you have to go over it several times. So you still need to use your hands. You can spray it into your hands. Here's one that we use and like. Just make sure you're putting a thick layer on. None of this from a distance trying to spray it, but put a thick layer on and make sure you're getting good coverage. Otherwise, we see a lot of speckled sunburns. So great question.
All right, and so for the second question, we have, what kind of sunscreen do you recommend for kids with sensitive skin and or eczema?
Yes, excellent. So again, especially kids, really, really important for good sunscreen, because we know a lot of the damage that occurs before the age of 18 is extremely harmful and increased risk of skin cancer. So again, the sun protective clothing, love these. That way you have to put less sunscreen on. You get more bang for your buck, because sunscreen, you can only apply it so many times before you run out, versus the clothing you can wash. But again, so for sensitive skin, the sun protective clothing and a physical blocker. The zinc, titanium, some brands that we use and like, Blue Lizard is fantastic, Vanna Cream, fantastic. There's many that are out there, but in general, I would stick to the zinc or titanium.
Okay, so the third question, what do you recommend for anti-aging for an approximate 30-year-old?
Yes, so the most important thing you can do, a good daily sunscreen every morning, face, ears, neck, and chest, men and women. So again, this is what I use. You can get it at CVS, Walgreens, $10 to $15, as well as local pharmacies, and shout out to Butt Drugs, as well as many other places. But face, ears, neck, and chest every morning, because sun and smoking are two major causes of wrinkles. Otherwise, if you're going to do anything, the most bang for your buck is a daily retinoid, is what we call the class. There's retinol, but Differin is the currently only available retinoid over the counter. It's for acne, so it can be used to treat acne, but also it does help with fine lines and wrinkles. Now this is something, it's a marathon, not a sprint. This is something that the effects are subtle. It takes a good 6 months to see. You do pea-size amount, entire face once a day. But if you're gonna do anything, that is the most proven bang for your buck, and it's $12 to $15 at your local drugstore. Other than that, you could also do an antioxidant in the morning, such as a vitamin C containing product. However, you have to be careful, because it's a very unstable product. So there's only a few out there that are actually truly effective. SkinCeuticals has one that's fantastic.
The next question, what type of face cleanser do you recommend?
A lot of it's trial and error and depends on your individual skin type. However, in general, a gentle skin cleanser. You don't need to do anything harsh or abrasive. You don't need a fancy brush or anything like that. Just make sure wash your hands before washing your face. Tepid, lukewarm water. You don't want anything too hot, and just gently apply and wash off. So there's many examples out there: Cetaphil, CeraVe, Vanicream, just gentle face cleanser. However, again, it depends a lot on your individual skin type.
Okay, next question. Why do people get skin tags? And more importantly, how do you get rid of them?
Great question. Very common. We see them in areas of friction. So excess weight can contribute to that. As far as getting rid of them, they can be removed by a physician or medical provider. It is a cosmetic fix. It's not typically covered by insurance.
The next question. How do I treat acne caused by my mask?
Great question. So this also called maskne. So what can happen is you can get clogged pores, accumulation of fluid and oil in the skin that can exacerbate acne by the mask. So importantly, use a clean mask every time. There's some thought that cotton that will not occlude or irritate the skin as much, so less friction. So again, clean mask. You want to wash your face before and after wearing the mask. A gentle cleanser. And then as far as acne treatments, some over-the-counter things that you can try that are very helpful, a benzoyl peroxide containing wash, and then that over-the-counter Differin that I mentioned, that does help with mild acne, especially the early acne lesions, the whiteheads, blackhead type lesions. You also want to make sure you're using a good moisturizer, because the breakdown of the skin barrier by the mask and other factors can also exacerbate and worsen acne. So good gentle moisturizer that's non-comedogenic, won't clog your pores or worsen your acne. And then also limiting the products that you're using under your mask. So you might want to consider not wearing foundation if you're typically wearing it, and or make sure that it's non-comedogenic, won't clog your pores or worsen the acne. So those are good places to start. And again, if you're continuing to have issues, seeing a dermatologist. But clean mask, cleaning your skin before and after, especially if you're working out and you have to wear a mask, wash your skin immediately afterwards. Thank you for joining us for our first session. Hope you all enjoyed it. Please keep sending the questions. We look forward to hearing from you. Take care.